Okay, that's all good to go. Brilliant. Good afternoon, everyone. So I'm Katie. I'm the careers consultant, one of the careers consultants that works at Imperial in the main careers service, but I'm actually also the careers consultant that works with the medical school. So in my previous lives, I've worked with the British Medical Association. I've run the careers service for them, and I've worked at a few different universities, helping with both recruitment for graduate entry medicine and standard entry medicine, but also I've always worked with kind of medics and doctors. Well, specifically, I worked at St George's, where I was involved in the graduate entry side of things. But because of that, I've got a little bit more knowledge in this area. So this is why I'm running this session for you today on graduate entry medicine. So the idea of the session, as any of you that have looked into applying for graduate entry medicine, we know that the deadline for UCAS for next year has just passed. So the idea of this session is it's been created to give kind of a basic introduction to anyone that's interested in applying for graduate entry medicine. So some of you will know some of the stuff, some of you might just be coming at it from a very, very base level. I'm interested in it, I don't know much about it. So do please feel free to drop questions into the chat as we go through. If I'm going to answer them in the next few slides, I won't address them at that point, but there is some time at the end for us to go through a few questions, hopefully. The other thing I do within this session is I talk a little bit about the application process, just to give you an idea of it, but I will also give you places where you can go and find more information about certain things. So overall, our plan for today is to kind of help you to understand how you might go about kind of choosing medical schools, what you might expect at a medical school when you're applying, when you're going through that medical training to become a doctor, but also to start to help you think about what you do when you become a doctor, because a lot of what you were put into that application form and that initial application form helps the reader to understand that you actually have reality checked the idea of becoming a doctor and a clinician long term at the end of that training, because as some of you may already know, just doing the 4 or 5 year graduate entry program, or even a 6-year undergraduate program, that's only the beginning of becoming a doctor. After that initial training, you then have a whole postgraduate training process where you're actually, you're working as a doctor during that postgraduate training process, but you're still what they call a trainee or a junior doctor whilst you go through that training process. And for some specialties, that particular training process can be another 8-9 years before you actually make it to that role of consultant. So I guess that within this session, what I'm hoping to do is give you an overview of all of those sorts of things, so you feel that you're in the right position to make a decision as to whether going into medicine and becoming a doctor is for you, but also to help you understand what that process might look like if that is what you decide is for you. Okay, so that's the plan for today. We've got an hour. Unfortunately, I really do have to leave at 2. I've got another meeting, but you'll all have my email addresses. So if we should hopefully get through all the questions, but if we don't, you can email me. That's not a problem. Alrighty, so just to give you an overview, in medicine in the UK, there are lots of different qualifications that you actually gain out of it. So similar to what you're doing at the moment, a BEng or an MEng, a BSc, MSc, the qualification that you get once you finish your medical degree is a little bit different depending on the university you go to. So at Imperial, we run an MBBS program. I know that at UCL they run the MBBS as well, but different universities call that qualification something different. So this slide just kind of goes through what those qualifications, if you like, or that initial qualification is going to be called. But actually, all of these things are registered by the General Medical Council, or the GMC. So the GMC basically regulate doctors. So they also regulate the training that you go through to make sure that it is the right sort of training that's going to give you all the skills you need to become a competent doctor. Okay, so you'll hear a little bit more about the General Medical Council as we work through the talk, because they have created sort of how there's a document called Good Medical Practice, and that kind of dictates the values of a doctor and what it is that you sort of need to follow, that sort of professional element of becoming a doctor. So the General Medical Council, they regulate the training in the UK. There is another organisation called Medical Schools UK, which work with General Medical Council to support medical schools, making sure that they are offering the right sort of training. Now, when you leave your initial qualification, so your MBBS or your MBCHB, you still are not a fully qualified doctor. You have your initial undergraduate degree, but then you need to complete what we call a foundation year 1, which gives you your full registration with the General Medical Council. So quite often in different countries, you would have seen that medical qualifications or medical school degrees are 6 years without an intercalation, or if you do a graduate entry qualification, then they'll be 5 years. Whereas in the UK, we run a 4-year standard graduate entry program, or a 5-year standard entry program, and they basically split off that final year, and you become a doctor in that final year. So you get paid, which is great, but it does mean that you don't hold full registration. So yes, Darius, absolutely. I will let you know when it's up. It will come through in our newsletter. So don't panic. That will be not a problem. So once you've gained that medical degree, you then need to work for 1 year as a foundation year 1 or a pre-registered doctor to then pass all the things that you need to pass to be a fully qualified doctor in the UK. Okay. And if you want to work overseas after that, it's the qualification of registration that actually allows you to move into different countries if you're interested in working in different countries. So hopefully that makes sense. A little bit complicated, I realise, but what you'll find is if you look at other universities, so if you were looking at studying medicine in a different country, quite often you'll see their programs are 1 year longer than the UK programs, and you come out of your time at university fully registered. Whereas in the UK, they just do it a little bit differently. They send you out with pre-registration, which means that you get paid, which is quite nice for that final year. So just to reiterate that the graduate entry program, there are in the UK at the moment, there's 17 courses available. All of my slides, you'll notice, have got live links on the bottom. So I'm going to send you guys out all the slides so you've got those live links so you can explore it a little bit further. Imperial at the moment is not offering a graduate program, a graduate course. So there were 18 last year, but not at the moment. So you will have to look at different universities, and they're sort of spread across the country. Every year I work with students who have a degree, and some of them are looking at going into a graduate entry course. Some of them are more interested in going into the undergraduate course to do the sort of the full 5 years. It's absolutely up to you. Both of those courses will get you the qualification. Obviously, one of them's a year shorter. What they tend to do in a graduate entry program is that you don't get any less content, but because you've already done a degree, it's assumed that you understand how university works. You have learned how to learn, if that makes sense, because you've already done that degree. So what tends to happen in a graduate entry program is in that first year, you will tend to get a lot more content. because you know how to learn. So quite often, and I've worked with lots of graduate entry cohorts, that first year is really full on. So some students I work with are interested in giving themselves a little bit more time to process that information. So they go for a standard entry program. It's absolutely up to you which one you choose. Both of them will give you that qualification to become a doctor. Okay. One of the things that may impact which program you choose is the funding for it. So there are a few things about the funding, that the different funding that's available for the standard program or the undergraduate program, if you've already got an undergraduate degree from the UK. So there are various different rules and regulations about how much more funding you can get to do another undergraduate degree, which is quite often why people might go for the graduate degree option. But I am not an expert on the funding at all. It changes slightly every year. So I would definitely recommend, to find out more about the funding, have a look at the British Medical Association. Again, there's a link there. They every year produce like a funding guide that can help you to understand how much funding you can get for the various different courses. So if you're looking, well, it'll be for the year after now, hopefully the folk on this call, you just need to wait a little bit. They'll produce their funding guide. It usually comes out, the new one comes out about March, April, once all the regulations have been entrusted, and then you can have a look and see what your funding will be like. But also, every university that offers a graduate and an undergraduate medical degree will have funding information on their websites, so you can start to explore that a little bit more. So the other reason some people go for a standard entry or an undergraduate entry program is because it's slightly less competitive. So just to give you an idea, and you'll see these are the 2022 application numbers, just because they haven't released the latest ones yet. But this website link gives you the latest information. And this just gives you an idea of how many students places there are on graduate entry courses. There's also how many student places there are on undergraduate entry courses in the UK. So it just gives you an idea of how many places there are, which means you can then start to figure out how competitive it's going to be. Generally, there's a lot more competition for the graduate entry programs, purely because there are just less places. So when you're starting to think about what university you might want to go to, what program you might want to do, this may be something you want to consider in terms of it. It changes a little bit every year, and what you'll also find on this website is sort of an indication of how much you might need to get in those entry qualifications. So in the entry exams, which I'll talk about in a minute. But this is really interesting information, but it might not be the thing that drives your decision. So Emma's just asked how much they need to give if they were going to start running a postgraduate degree. So they need to advertise it for the year before. So quite often what we find, Emma, is that they'll give a couple of years notice before they start that postgraduate degree, purely because they won't have a cohort if they do it too soon, if that makes sense. So there's also some rules and regulations they have to meet in terms of competition marketing. So so it's usually a couple of years notice if they're going to run a postgraduate degree. Okay. Cool. All right. So just to highlight this competition difference between the graduate program and the undergraduate program, we were able to get some figures from the University of Southampton. Now, these are from a few years ago. I think they're from 3 or 4 years ago. So they you know, they're not the most up to date, but these figures aren't often released. So as you can see here, for the graduate entry program, they had about 40 places and they got 1,600 applicants. but for their undergraduate entry program, they had a lot more places, and they got sort of slightly more applicants, but it just means that ratios are different. Are different. So we also have a quote from Dr. Christopher Stevens, who's the Associate Dean from the Faculty of Medicine at University of Southampton. And he said, you know, many of those rejected would have made good doctors. It was just that they can't take all of those places. So if you are looking at graduate entry, you might want to look at some of the universities that run the slightly bigger programs. So those are, I think it's University of Warwick, University of Nottingham run quite a big program, and University of Swansea. So those are the ones that tend to run the bigger programs. But obviously it's up to you if you want to apply for those, but that can be something that you might want to take into account when you're choosing universities. Sorry, I've got a bit of a cold. The other thing so this is kind of bringing it all together. When you're thinking about these various different universities, other things that can come into play are thinking about, you know, how you like to learn, and will the university be teaching in the way that you like to learn? So this is the benefit of being a graduate and having gone through university. You understand how university is different from high school. So you can then start to think, okay, well, do I like to learn in a way that's sort of more problem solving based? Do I like to work with cases and try and figure them out? Because actually there is a problem based teaching style that some of the universities use, as opposed to sort of the more traditional style, which is where you might sit in a classroom and be taught sort of lecture theatre mode, whereas quite often problem-based learning you do in small groups and you work together that way. So, you know, looking at the universities that are offering the various different programs and thinking, okay, how do I like to learn, and are they going to teach me in that way? So, for example, quite often Oxford and Cambridge have what we call more of a traditional teaching way. UCL and Imperial used to have this way. They've now moved it slightly towards more of a clinical focus. But then places like St George's, a lot of their teaching was sort of problem-based or case-based learning. So thinking, which one suits my learning style? And maybe that's a university you might want to consider applying for, purely because, you know, that's going to work better for you. You know, that's how you like to learn. So again, financial positions, we've talked about how you find that information out about funding, but also thinking about sort of where you are in your life. So quite often, so with some universities, they tend to have a student population that might be it might be a bit younger. So, you know, they may have just come, a lot of the population of that university might be undergraduates who are straight out of high school. And so if you're looking at doing a graduate program in a university that is mostly full of kind of undergraduates or younger students, then how much support will there be for a graduate cohort for someone who might be a little bit older and might have slightly different needs and requirements? So when I was at the BMA, I used to work with lots of different universities, and it was interesting going over to the University of Swansea, who not many people think about going and doing and studying over in Swansea because it's a bit further away, it's in Wales, but actually they only offer a graduate entry medicine course, which means that all of their student support is geared towards graduates who are slightly older, who might have sort of families and dependents and different needs and requirements. So some of these things you can start to think about when you're applying. Obviously, geography is one of them that everyone comes into account. So you'll find that the competition ratios for London universities are always higher, purely because lots of people know London. So you guys will probably all know London really well, and they want to stay in London. But actually, the way that the medical training pathway works is it doesn't really matter where you study geographically. You can always apply to come back to London to do your foundation year 1 and 2 after you've finished your degree. So just consider all of these options when you're choosing the universities. And there's a couple of other bullet point tips in here. So thinking about, looking at those admission requirements. And there are some links. Well, I've got some links on the next couple of pages that tell you what those admission requirements are. Some of the universities require chemistry, some of them require biology. So sometimes you may not have the entry requirements for certain universities. But it's worth looking and exploring these different options to help you figure out what 4 universities. So you get to write 4 universities on your UCAS statement, or 4 medical programs on your UCAS statement. I'd also think about, being quite strategic with how you what universities you might choose. So you might have sort of a university that you really want to go to, but you know that it's really competitive. So actually, you put that one on, but then you might also put down a couple of other universities that might not be quite as competitive, or might take slightly lower entry exam marks, just so that you've kind of got yourself a spread. There's not a lot of point in putting on 4 universities that have very similar entry requirements and very similar kind of levels of academic requirement needed, purely because quite often if you don't get into one, you might not get into any of them. So, but then that's a discussion you kind of have to have with yourself around, do I actually want to become a doctor no matter what, or am I interested in becoming a doctor if it meets these other requirements? And that's, something that you take into consideration when you're choosing those 4 universities. To help you with doing that, there are a couple of quite good websites I just want to highlight. So this one here allows you to compare and contrast the different universities. So it's quite a good one. It gives you a lot of the details of, what sort of style teaching they have. It gives you an indication of what exam result you might need for either the UCAT, GAMSTAT or BMAT, just to see how competitive you might be. And then the second one is the Medical Schools Council, and this is where you can find the most up-to-date information on things like the entry requirements. So these are the guys that help to organise medical education in the UK, or medical undergraduate education in the UK. So these 2 websites are both really useful. Definitely recommend having a look at them, just to find out some of those things that you might want to know before choosing your 4 universities, which is, I think, one of the biggest things I end up talking to lots of students about is, okay, well, how do I choose which university I go to? As I said, because the UK medical education system is really regulated, quite often what you learn at the universities will be relatively similar, just because at the end of your 4 or 5 year qualification, you will need to sit a common exam called the Medical Licensing Assessment. So it's the MLA. That's coming in this year. That's starting this year for the first time. And the idea is that every university's students will sit the MLA, and it means that every doctor that moves into foundation year 1 has this kind of level of competence that's been assessed across the board. So it's quite a good thing, I think. It means that everyone has the same level of information or same level of competence before they move into medicine. Okay, so what you learn at each university will be the same, but quite often the way that you learn it will be slightly different depending on that university style. Okay, so just a few things to keep in mind. The other thing that quite often people ask questions about are sort of the exams that you have to do. So for most medical programs, you need to do an extra set of exams. Some of them you don't. Some of them, so every university has a different way of recruiting, and quite often you'll find that their undergraduate program is different from their postgraduate program in the way that they recruit people. So definitely read the instructions and those entry requirements. The first thing to pop into your diary are the sort of important dates. Now, I realise I've got a group of people on this call. Some of you might not be looking at applying for a couple of years. Some of you will be looking at applying next year. To give you an indication of the dates, so generally the application for UCAS will close on the 15th of October every year. That's been the same for the last sort of 20 years, okay? With the entrance exams, these tend to run at the same time every year, okay? So you can find out, I've got my next slide is all about the entrance exams. So you might not know the exact date of the entrance exam if you're looking at applying sort of in a couple of years, but you'll know roughly when. Okay, so that's what I've tried to do with this talk, is give you roughly when, so you can add that into your timeline, so you can start to kind of work towards that application. Okay, so these are the three different exams. I've put a little bold bit there for BMAT. So BMAT, there's only a few universities that use BMAT, 5 or 6, I think. BMAT is not going to be a thing after next year. So they're still using it for this year. And I think that some of them, yeah, there was a bit of conflicting information online. So that's why I tried to sort it out for you guys. So they're still going to be able to use BMAT this year. And lots of the universities haven't told us what exam they're going to use instead of BMAT for the following year. Okay, so that's why I've put that little note there. If you're looking at a university that you currently use as BMAT, then probably for next year, well, they will be using something different for next year. We just don't know what that is yet. They haven't let people know. I expect in the next sort of few months that on the various different websites, these sorts of things will be updated. I suspect they'll probably move to UCAT, but I don't know for sure. Okay, so don't quote me on that. But if you are looking at applying to a university that's going to use BMAT, just keep an eye on their website. They'll update it once they are ready to inform everyone of what exam they're going to use instead, or what method they're going to use instead. Okay, so just a heads up on BMAT. GAMSTAT and UCAT are, well, UCAT's the most common by far. There's a few that use GAMSTAT. The main difference being between these sets of exams is that BMAT and GAMSTAT tend to test a little bit more of your sort of academic knowledge and that sort of biological or chemical knowledge that you might have, whereas UCAT tends to be a little bit more situational judgment. So what would you do in this situation? I would also watch this space if you're not looking at applying to any of these programs for a few years, purely because these tests were used because they correlated with the test that is used at the end of your medical degree to help you move into Foundation Year 1. And that way that you are recruited into Foundation Year 1 at the end of your medical degree has just changed. So they've brought in a new system for that this year. So there's a chance that some of the universities may review the way that they recruit their students in the next few years. So whenever I put something like this out, I always kind of try and cover myself a little bit by saying there may be changes within this, but the place to keep up to date will be on those websites that I've already mentioned. So the UK Medical Council website or the Medic portal. Those two websites are updated quite a lot, and so if you just keep an eye on those, that will help you. But these are all live linked, so when you get the slides, you can click through to the UCAT, GAMSTAT and BMAT websites and get an idea of what sort of resources are out there to help you prepare for these exams, what sort of prices they are. So to be honest, UCAT's quite reasonable compared to the BMAT and GAMSTAT prices. So you might want to, I've worked with students who have chosen universities because they wanted to focus all of their attention on studying for one exam, so they could really get a good mark within that. And and that's helped them to decipher which 4 that they might want to use. So if that's something you're interested in, you can just take that into account. Okay. So I'm kind of now moving into some of that process stuff and what you might need to think about when you're actually going into the application side of things. Okay. So the UCAS application, you guys have all filled in one of these before. So actually it's exactly the same. It's due in a little bit earlier, but it is pretty much the same. Just to let you know, again, there's going to be a change in the UCAS application form. So if you're looking at applying in a couple of years, so 2025, so not next year, the year after, sorry, next year for the 2025 intake, you will have to answer questions instead of a personal statement. So when you all applied, you wrote that personal statement of 4,000 characters. Now it's going to be short answer questions. We don't know exactly what those short answer questions are going to be, but again, watch this space for more information. I actually think that it will be easier to fill in a short answer question than have to write a personal statement. Okay, so hopefully this is going to make it a little bit easier for you. But within that UCAS application, these are the titles that you need to fill in. And as I said, I'm going to go through some of these as we in the rest of the session. So just to help you get an idea of how you complete this form. The one thing that you will need to note is that you are applying. So when you applied last time to university, you applied through a high school generally. Unless you are a graduate anyway who came in. This time you're applying as an independent because the university, you can't apply to go to another university from one university, if that makes sense. So sometimes, and I don't know if this will change for next year, sometimes you need a thing called a buzzword. And the buzzword, quite often, either your referee will know or the university hub knows. So don't worry about that for now. But if you do get asked for a buzzword, just remember Katie mentioned it, and there are places you can find that buzzword. And basically the buzzword connects you to your application and your referees. Okay, so sometimes they need that, sometimes they don't. I'm not a UCAS application expert. However, UCAS have a super useful helpline and you can ring them at any point and they can talk you through that process. So I don't often recommend helplines when you have to phone people up to ask them questions because usually they're not very good, but the UCAS one is always spot on. So definitely make use of all of those resources on the UCAS website. They've got some really good support and help there. I am going to talk you through the personal statement, even though there's a high chance that you won't need to write a full personal statement. The reason I'm going to talk you through it is because I think that the questions, the short answer questions, will be quite similar. Okay, so the whole point of a short answer question or a personal statement is to match yourself to either the medical school or match yourself to being a doctor. Okay, and that is one of the key things that when I'm recruiting into the universities, what I'm looking for is somebody who's really thought about and reflected on how they know they want to be a doctor, because it's such a big commitment. So becoming a doctor, if you've spoken to any doctors, which I definitely recommend you do before applying for graduate entry medicine, is not really a job. Being a doctor is much more of a lifestyle because of the way that the NHS is structured, the training has to occur. So thinking about, how have I reality checked what it's like to be a doctor? And I suspect that that will be one of those short answer questions is, why are you applying to be a doctor? And what I need you to do within this is match yourself to that role. So what you need to do between now and your application is find out what a doctor does. What's it actually like to be a doctor? And so then you can break down that role of being a doctor. What are the main elements of it? And start to think about what you've done in the past that you enjoyed that match up with what the main elements of being a doctor are. So it's actually really similar to answering any job application questions when they ask, why do you want to do this? You're actually thinking, okay, what is it actually going to involve? How do I know I want to do it? Because where have I done it before? Oh, look, I match with being a doctor. Okay. So starting to think about the answer to that overarching question, why do I want to be a doctor? Okay. And a lot of these other questions I've got underneath it, or statements I've got underneath it, quite often will fit into helping you answer why you want to be a doctor. So thinking about, what have you done to help you understand what that doctor role is? What have you done to help you think about what skills you might need to be a doctor? You'll notice as I'm talking, I'm saying the word doctor a lot. So one of the things that when I was shortlisting at St George's, or when I was reading personal statements, we didn't actually use the personal statement to shortlist when we were at St George's, but one of the things that I was looking for, I was not looking for somebody who wanted to go into medicine. You had to be really specific about being a doctor, because quite often you'd get people saying, oh yes, I really enjoy science and I really enjoy helping people, which is fine. That is kind of the basis of being a doctor, but it's also the basis of being a nurse or being a physician's associate or being a physiotherapist. So I'm really looking for, what do you understand the role of doctor is that is different from being any of these other sort of healthcare professionals? And how have you matched yourself to the specific skills and sort of values and attributes of being a doctor? Okay. So that's just something to keep in mind when you're going through that process of applying, or if you, between now and when you do need to apply, you're thinking about what sort of experiences and work experiences you can have. And I've got a slide on that at the end to help you find those. But what do you need? What else do you need to know about being a doctor to help you to answer that question? Okay. And that's really the core of both the personal statement and the interview. Okay, so why do I want to be a doctor? There is some content out there to help you with that. So just like with every other job, there's quite often sort of a job advertisement for it. Now, this is obviously a bit further down the line. So this is that first doctor role that you would have outside of medicine. They call it Foundation Year 1, or FY1 for short. And this is a person specification that explains what skills you need and what attributes you have to be a doctor. So obviously these are the things you're going to learn during medical school. But if you're thinking, how do you think, yeah, sorry, Emma, I'm not sure that they will, purely because other healthcare professionals, we don't train. So if we don't have a university course that trains other healthcare professionals, it's very hard for the employers to come along to talk to them, because we don't have physiotherapists. However, this is where things like LinkedIn can be really helpful to help you find different healthcare professionals. We do run medical careers fairs every other year, so you can find out a bit about coming along to being a doctor. But healthcare professionals, that's something you might need to explore a little bit by yourself. But we can definitely talk through that. I'd recommend booking a one-to-one appointment to come and talk about that. Yeah. Okay, cool. So going back to being a doctor and thinking about these FY1 person specifications, this can help you to understand a little bit more about some of what you are going to have to prove to be that doctor out the other end. That can be helpful. I always get questions about referees. So again, for university, you can definitely have your personal tutor. So if you know your personal tutor well, that's a really good starting point. You might have someone that supervised a project that you were doing that you feel more comfortable asking for. That's absolutely fine. All of your academic tutors and trainees will be fine as referees. You could also ask, so you might need I think you need 2 referees for this one. So you might have your personal tutor and a supervisor. You might have someone that you've done an internship with. That's absolutely fine as well. If you've done some work experience in a hospital, you might have someone who's done that as well. Just to let you know that when I was recruiting for medical degrees, actually who that referee was less important than what they were able to talk about in terms of how competent you were. Okay, so I have had conversations with a few people that have said, oh, this person said they'll be a referee for me, and usually they're a consultant doctor that you might have work shadowed for a week. That can be fine as a second referee, but as a first referee, I need someone who actually knows how you work at university, because they're going to be able to tell me a little bit more about your study habits and your predicted grades and things like that. Okay, so just read the rules about referees. I've also put a website in here. We've written a whole webpage on choosing referees and how to approach them. Okay, so those are the main questions I tend to get about a UCAS statement. I'm now going to move into some of the kind of selection day criteria and what you can start to expect, but also some of this feeds into other things that you might do to reality check that idea about being a doctor. Okay, so if you start to think about a selection day, again, every university runs their own version of this. So some universities will run a very standard sort of interview panel where you'll sit there and be interviewed by 3 or 4 different people who will ask you questions. Some universities will run what they call a mini multiple interview, where you might have 3 or 4 minutes with an interviewer and you'll answer one specific question and you'll move to a different interviewer. So it depends on the university. The mini multiple interviews are becoming more and more common and more popular because you can get through loads of people all at once. So I know at St George's, that's what we used to run. We had 5 interview stations and one of them was a group station. So you do a group task. One of them asked you an ethical question. One of the stations asked why do you want to be a doctor question. One of them was a practical sort of problem solving kind of logic puzzle that you had to do. And the 5th one was, that was just looking through some of your skills. So what skills do you think are most important in being a doctor? So that's just one indication. Quite often, the universities change these every year, so you can't be too prepared. But definitely once you are invited to an interview, you should have more information about how that's going to run. So that's what I've kind of put, that's what I've trying to put on this slide, basically, is just think about those practicalities, think about what you need to SWOT up on, but definitely think about what you've already sent them. So when you fill in that UCAS statement, make sure you keep a copy so that you've got all that details there, but also research the university a little bit more, because quite often in a UCAS statement, you don't say why that particular university, because obviously it goes to 4 universities. So you might want to do a little bit more research on the medical school, try and get in touch with some students who are studying there through LinkedIn or through connections that you might already have, and then just find out a little bit more about that medical program. Now, just to help you understand medicine, and obviously in the UK, medicine, when you train to be a doctor, you do it through the NHS. That's the only way to do that postgraduate training to specialise in medicine. There's just a couple of links here. So I mentioned the GMC already, who regulate doctors. They have got a good medical practice guide for students, which is really useful just to have a look through. When you are a medical student and you're going into hospitals on placements, you must adhere to the good medical practice guide for students anyway. So it's worth having a look at that. And then quite often you'll be asked about, what about the values of being a doctor? And actually the NHS has got its own values. So to work in the NHS, you must adhere to these particular values. So it's good to have an idea. I mean, the values that the NHS have are quite similar to what you think a doctor should have anyway. So that idea of empathy, being able to work with lots of different people, supporting each other. So I've just popped those 2 links up there because they can help you to prepare for interview, but also to think about whether you want to be a doctor, a full stop. Group tasks are something that are really common, especially in those mini multiple interviews, purely because as a doctor, you'll be working in what's called a multidisciplinary team, or an MDT. So there's lots of acronyms within medicine. That's just one of them. So an MDT is made up of nurses, physios, different types of doctors. So for example, if you have a patient who is suspected of having cancer, you would have an oncologist, you'd probably have a radiologist within that team, you'd potentially have a specialist cancer nurse. So what tends to happen is you have to work together quite a lot with people from lots of different backgrounds, lots of different clinical makeups. So as part of the recruitment into a medical program, they want to make sure that you can work as a group. So you will usually be asked to do a very quick task as a group. They're not that bothered about whether you complete the task as much as seeing that you can work with others. So thinking about, how do you involve everyone in a conversation while you're going through university? Actually, if you're doing group tasks, which I think most of you do as part of your undergraduate degree, maybe not so much for some of the master's programs, but undergraduate, think about how you work as a team. Think about what things you do to make sure that everyone plays a part or plays a role within that. And that's what you're trying to emulate. The Careers Service does do a careers session, a careers lab on working in groups, working in teams, and definitely worth going along to that if you are going to have to do a group task as part of a mini multiple interview. Now, the interview itself, and sometimes I say interview, what I'm really saying is those questions, the questions you need to answer. So this will form part of a mini multiple interview, but it can also be a panel interview. In some universities, they'll just have a panel interview for you. And they're going to ask you the same sort of questions as you would expect. So some of the things that you've already answered in that personal statement, things like, tell me about a time that you've had to adapt your plan. Tell me about a time you've worked in a team. Those core skills that you would have seen on that Foundation Year 1 page. When have you done this? When have you led? When have you had to, work with people that were difficult to work with? What did you do? So that sort of storytelling side of things. There'll also be questions about your commitment. So why do you want to be a doctor? Why do you want to come to this university? Understanding the role. What do you think will be most challenging about being a doctor? And then they might ask you why you think you'd make a good doctor, or what sorts of things would you like to tell us about you? So that's what I mean by unique selling points. It's always worth, when you're going into an interview, having sort of 3 overarching things you really want that person to remember about you when you leave. Okay. As I said, sometimes these questions are split out into those mini multiple stations. So you might not necessarily get much about that unique selling point. It might literally be, answer this question, you've got 3 minutes, right, move on. Okay. So it just depends on the layout. But in terms of your preparation, these are definitely things you want to think about. And I've linked through to a website that's got some more content on that. We also have a Career Essentials session on interviews, which will be really useful. We have a tool called Shortlist Me for the Careers Service, and you can log in. There is an example of a mini multiple interview there for doctors and dentists. It's an ethical question, and it's really interesting to work through just to get a feel for how you how that actually works in practice. So sorry, the picture isn't of this. The picture here is my colleague Rich doing a AstraZeneca one, but there is a mini multiple one, and as you click into it, you will see interview for medical school or dentistry school, and that will take you through that so you can have a go in it. Every year, there are some universities that will want to test your knowledge of the NHS or to help you think about, some of these ethical questions. So I've just added a few in here, but all this is what we call commercial awareness. So understanding the environment that you're going to be working in. So one of the best ways to keep up with this is just by watching the news and listening to, what's happening within health. There's a few here. If you look on any of the websites, so I've got a whole lot of different websites you can look on here just to keep up with the healthcare news and to better stay in touch with this. This is the sort of stuff patients quite often ask you about when you're a doctor or when you're on placement as a medical student. So it's just something that you can kind of pre-warn yourself with. So that's why we ask it in interviews. Not every university asks these sorts of questions, but some of them do. Cambridge and Oxford tend to. So definitely worth just having a bit of an up-to-date knowledge. And in that vein, there are always slight changes coming within the NHS. So the NHS is definitely a very politically driven kind of organisation, and every time we get a new government, you'll get new rules and regulations around the NHS. There'll be new reviews. There's new diseases coming in. So these are just a few things that I have heard people get asked at interview about particular reports, although that's quite specific. Quite often what they might say is, what do you see the role of doctor? How do you see the role of doctor changing in the next 5 years? So that's why the Future Doctor Review is quite an interesting read. There's things about, there's always changes happening within postgraduate training, but don't panic about those too much. That's just something to think about. When you're going into that world of becoming a doctor, how do you cope with change? And is the fact that somebody might change something further down the track going to upset you in any way, shape, or form? Okay. There could be changes coming in because of COVID. Definitely looking at primary and secondary healthcare, and if you don't know the difference between those, definitely start to have a look at those. But then introduction of new healthcare models and new roles. So there's lots of different roles becoming available. So I mentioned one already, physician's associate. Those weren't around 10 years ago. So how does a physician associate fit into that healthcare model? So these sorts of things you can start to look up. All of them will be on those current affairs links that I've just put through. It is also always worth knowing who the current Secretary for Health and Social Care is before you go into an interview. Last year when I did this talk, it had changed about 6 times in the previous year. This year, it's the same guy, Steve Barclay. He's been the healthcare minister for the last year at least. So, but that's something to look up just before you go in. So in terms of next steps, so just to let you know, I'm coming to the end. As I said, I do need to leave at 2, but if you've got any questions, start to type them in. If not, I'm going to email you the slides so you'll get everything and my email address so you can respond to me. One of the things that lots of people who apply for graduate entry medicine have done, if they applied for undergraduate entry medicine, is that they've done lots of work experience. Then as you come to university, quite often you don't do any more work experience. It's definitely worth trying to get some more work experience. If you can't get them in hospitals, don't panic. It's really hard to get work experience in a hospital or work shadowing with a doctor. However, quite often what I'm looking for is the fact that you can work with lots of different people. So lots of different people groups, because obviously as a doctor, you'll need to work with all sorts of different people who aren't like you. So if you're thinking, what can I do to strengthen my application? And you haven't done sort of volunteering or work experience with various different groups of society. So working with children, working with disabled people, working with old people, working with homeless people, thinking about, is that something I can do to strengthen my application, to say, actually, I have had to adapt my communication style because I've worked in an old people's home or volunteered in an old people's home. So there's lots of links on this website that go through to places where you can volunteer or get work experience. The bottom link is something that the medical schools do, and it's a massive, big update of places that you can get work experience. So definitely worth a look. The other ones are just ones that quite often people ask me about. You can also just have a look at your local hospital and see where their volunteering website is, and in that way you wouldn't have to save yourself a trip. Okay, so that was my very quick run through of introduction to medical school. What I'm going to do from here is email everyone that attended the slides, and then it'll take us a couple of days. Oh, yes, absolutely, Emma. Mentioning lots of different people within the public. That's a really good way of doing it. You probably want to try and get some experience in a hospital or talking to a doctor, just so you can answer that question of why doctor. But yeah, really good experience there of dealing with lots of different public people. Nice. That'll be good in any application. So yeah, I'm going to email you out everything. It'll take us a couple of days to upload this to the website. So I'll re-email you in a couple of days once this is live on the website. So if you want to watch it, again, you're more than welcome to. But other than that, I'd best go to my next meeting. So hopefully that was useful, team. I will send everything out to you and then we can take it from there. But thanks a lot and have a great afternoon, everyone. Bye.